Legal advice, because there's always small print. We must remind you that the health advice given on this show is general advice, and that for any specific condition you must seek the help and guidance of your doctor or a professional medical advisor before commencing any treatment or any kind of dietary regime. And welcome to the Health Show, where our programme today is on arthritis. We have our team of alternative practitioners.
Liz Nagle, naturopath and thermographer.
Hello and welcome, my name's Leonie, Amond, kinesiologist and sports masseuse.
I'm Jeremy Kenton, an osteopath.
Kate Moss, yoga teacher.
And last but not least, Juliette Noske. I'm a yoga teacher and a life coach.
And today's episode, our show today, is on arthritis, where there is so much misconception about the different types. So broadly speaking, we've got two types. We have degenerative arthritis, known as osteoarthritis, and we have the inflammatory types. And those inflammatory types subdivide into what are called seropositive, such as rheumatoid arthritis, and then there are lots of others, such as the seronegative types. Now, the classic one for seronegative arthritis is ankylosing spondylitis, and we're very lucky enough today to have
Cameron
Gare.
Yes, good old Cameron Gare.
That's because you mentioned Harold, ex-RAF pilot.
Yes,
does help you get the guest name right. And he's suffered from a particular type of arthritis called reactive arthritis, which is one of these seronegative. And it's amazing that people don't realise that they can get things from infection, such as reactive arthritis. His was a salmonella, true food poisoning, that then spreads into bones and joints and leaves you with a lasting deformity which will last for the rest of your life. So I'm just going to go off into Studio 2 and I'm going to interview him. I shall be back. I shall be back. Take this with me. And as we were saying, there's inflammatory types of arthritis, one of which is the seronegative. And one of the classic examples of that is something called reactive arthritis. And we have Cameron Gare with us, who unfortunately for you is a sufferer. Tell us what happened, Cameron.
Yeah, indeed. I contracted, actually, salmonella food poisoning nearly 28 years ago.
And you were how old?
I was 19 years old at the time, and got a really bad case of salmonella food poisoning, but the symptoms that actually showed up first, apart from just the food poisoning, was I started to have joints on my body swell up. So my knee swelled up to 2 or 3 times its size, my elbow, and then the heels on the back of my feet. And I was diagnosed with having salmonella food poisoning, but also with reactive arthritis. That then continued on, and I was ultimately diagnosed with a disease called ankylosing spondylitis.
And reactive arthritis, as you then learnt, comes on from, said he, dropping a bit of spine. So we've got a spine here, dead person. And the classic thing that happens with that is that you get this bony bridging, these spurs, syndesmophytes.
My spine basically has calcified and grown itself together.
Yep.
So rather than having what most people would have, which would be a bone and then the disc all the way down, my bones have actually grown together and have formed one large spine, like a piece of bamboo.
And that's what it's called. It's called bamboo spine. And if we look at your x-rays, which are here, we can actually see it looks like a whole piece of bamboo.
Indeed, it
both
feels
from
like
the
a piece of
front
bamboo.
And from the side. So your movements, very restricted.
Indeed, very. The main thing is that the disease is progressive, which means that you can start and cope with it. As parts of your body seize up and fuse together, you develop coping mechanisms to try and conduct as normal a life as possible. The overriding problem now, though, is that my spine is actually just one thing, from the bottom at my coccyx all the way up to the occipital at the top where my neck is. It's effectively one long bone.
Yeah, one fused mass of bones.
Correct. So I have no rotation. The rotation that you're seeing now is the chair movement.
So for things like driving a car, for you, difficult, if you want to pull out of a junction, how much movement have you got in your leg?
I have to move my entire body. I use additional mirrors in the car, both an additional wing mirror and a panoramic mirror in the centre console. But for me, simply to just look over my right shoulder to pull out, I have to actually move all of my body because there is no neck rotation. So by the time I've looked to the right to check that there's no vehicles coming, then adjust my position again to look left, I need to look right again just to check that there's nothing else come. So it is actually quite limiting and restrictive, but I do make use of all the mirrors all the time.
Right. And what about the level of pain? Because with ankylosing spondylitis, one normally expects it to have burnt out with somebody by their early 40s.
Correct, yeah.
I've been
unfortunate in that sense, in that the disease, it has peaks and troughs. It has flare-ups where it really, really intensifies the pain in a specific joint, whilst the calcification and the disease activity is going on. But I also have had routine flare-ups in my knees, in my toes, in my knuckles on my hand, elbows, and other joints around the body. When that is happening, it is absolutely horrendous, the level of pain, which in the past was controlled just by oral drug therapy with tablets, non-steroidal anti-inflammatories, the ibuprofens and that sort of drug. But then latterly, other much stronger drugs, the COX-2 inhibitors like Celebrex, and then methotrexate as well, all fine at treating the symptoms, but never, ever, ever addressing the actual problem.
And the problem is you can't also take away those bony changes which have taken place.
No, the only way that there'll be ever any more movement in my spine is if I actually physically break my back, if you actually snap the bones apart again.
Not a good idea, though.
No, I don't want that to happen at all.
Right. Cameron, thank you very, very much indeed. A classic example. Thank you. Fascinating, wasn't it?
Yeah, lovely gentleman.
Lovely chap, and unfortunately suffering from such a severe condition that limits and restricts his lifestyle.
Yeah. But he's very positive, and do you know what? He's achieved an awful lot with that. He's built his own home with his own hands, actually, as well.
Well, the thing
he's amazing. He's an amazing example of somebody with that problem.
And he was an active jet aircraft pilot whilst he was actually suffering with the Royal Air Force. Amazing stuff. So the different types of arthritis, but the classic feature that happens with them all is the way in which it affects bone. Now with degenerative arthritis, as we wear out, if we look at this bit of dead body, you get the formation of what are called osteophytes, which are these bony spurs that appear as a ridge along, which limits the movement, and these literally jut in to the space where the nerves pass out from.
Pinching the nerves.
Pinching on the nerves, producing nerve compression, inflammation, pain. Behind us we've got what's called arthritis mutilans on the screen behind us, which is where it's affecting the hands, that gnarled hand appearance that you so often see in rheumatoid arthritis.
That's right. I have a friend that suffers from that, and she has to, her treatment is injecting her abdomen every week to stop the continued process. And it was very painful for a long period of time, and it's affected her hands. It started to hit her knees as well, and she'd have inflammation in the knees. But with the medication that she's using with the NHS in the UK, actually, it has stopped that process from continuing. So.
But the inflammation is one of the main things in terms of the way that it produces symptoms. I mean, for me as an osteopath, there's a lot that can be done with patients in terms of moving joints around and increasing the range of movement and reducing inflammation. But what about your therapies? What can be done? Yoga, for example.
As well. If you're moving, it can actually help relieve a lot of the pain that people might be suffering. You know, it's horrible to have to live with that pain. And yoga is one of the best forms of exercise, although it's not just exercise, but yoga is one with the asanas, the postures. It's one of the best forms to help relieve the pain by keeping the body moving, basically. It's a bit like you're WD-40ing the body and keeping the things working. And there's a fantastic website that I found with loads of information if people are interested about more about this. It's the Johns Hopkins website, which as you can see up here, and it has all information about how to find a particular yoga teacher, which poses might be good for you. It shows you all the different poses. But also not just on the asana side, but the physical side of the body, you know, the meditation, the relaxation can help you overcome the stress and the challenge that you might be going through on a psychological. I mean, we spoke about your friend who came in to give us the example, and as well, you know, you can see he's got this positive outlook, and that really helps. Then he goes and builds his house. So the positive outlook on it, shifting your mindset if you can, and looking at what you can do rather than looking at what you can't do, for example.
With the inflammatory
really
process, there are some foods that actually can activate more inflammation, from what I understand, like tomatoes or acidy foods can actually make it.
They aggravate.
Right, they can aggravate.
So my partner had AS as well, and but he didn't have any restriction with movement because it was caught very early, and he used to do a lot of exercising and everything. And also I treated him with the biomagnetic pair therapy, which helps just to keep the body free of infection, and just keeps it moving really, and brings down the inflammatory markers, and that's what we did. And he had full range of movement, despite having the AS for about 5 years.
Right. I mean, one of the things,
right?
yes,
We talked about this yesterday, right? Turmeric is a great anti-inflammatory.
Yeah.
What do you recommend with your?
Well, I'm sorry to say, with my patients, I tend to use the normal sort of approach in terms of non-steroidal anti-inflammatories, but they have no effect on the seronegative arthritic conditions, such as we saw with Cameron. There you have to use more mainline treatments, such as steroid treatments, prednisolone, which helps to bring the inflammation down quickly, because one of the main issues here is that with ankylosing spondylitis and the other seronegative types, it's not just about the restriction in the spine. They get effects on their liver. They get effects in terms of their breathing, because the rib cage literally fuses. And one of the classic features of it, if left untreated or treated incorrectly, is death. So you've got a condition that starts off as a fairly simple thing, but can have massive, dangerous repercussions. And so sometimes you need a fast treatment, not just as a way of getting rid of the pain and reducing the inflammation and improving the movement, but keeping them alive. They get something called amyloidosis affecting the liver. But moving back to the normal types of arthritis, that classic feeling, which I think that we're all at that age where we're beginning to get, other than you, is in terms of when you wake up first thing in the morning and the joints feel quite stiff. As soon as you get out of bed, if that stiffness goes, that's classic of osteoarthritis, normal degenerative process. If it's an inflammatory type of arthritis, that what's called short duration morning stiffness is classed as long duration morning stiffness. And it will last for hours. And if you're sitting there watching TV, or if you're in the cinema or in a restaurant, things begin to stiffen up again. Classic of degenerative changes, or inflammatory. The longer they last. So it's a good pointer for yourself when you go and see a professional to say, I get that stiffness in the morning, but as soon as I'm up and moving around, it calms down. And it's due to the fact that, remember, looking at that diagram behind us, remember our GCSE biology, joints where two bones meet together contained within a capsule, and they're bathed with the fluid, synovial fluid. But the viscosity of that fluid changes with arthritic conditions, and what happens is it should have the same consistency as clear honey, but during an inflammatory process it's more like clover honey. And that gets worse at night, or if you're sitting for a long period of time, because the circulation is not affecting it. So therefore what happens is the viscosity changes, and that produces that classic stiffness.
Does it not also release some of the synovial fluid as well?
Well, you get changes with inflammatory cells where what happens is the joint capsule begins to shrink and there's less protection around the joint. And cartilage literally wears away. So the space between a joint narrows, and with the hip, for example, diagram behind us, you end up with that narrowing of the joint space. And modern surgical techniques, from my point of view, are incredibly successful now in terms of hip replacements, knee
preventative
replacements.
methods as well. I work for a chronic back care clinic, and that dealt with articulation problems as well. And admittedly, there were a lot of senior people that were coming in doubled up in pain on walking sticks or Zimmer frames. And the procedure involved injecting a synovial fluid type liquid into the cavity to increase the mobility, to tremendous results. A lot of people would leave without pain, and also muscle relaxants into either side of the spine, into the muscle tissue, along with ultrasound, very high velocity ultrasound, which would relax the muscles, relax the vertebrae so that the discs weren't so pinched. And,
but I think it's worth mentioning, though, that it's all of those medications have problems with, can cause problems with digestion.
Oh, very much so.
So if we can do it more naturally, and oftentimes foods contain the ingredients that we need to bring down, like we said, turmeric and black pepper,
hot and
garlic.
Cold compresses are good as well.
Yes, hydrotherapy.
Swimming, water therapies, hydrotherapy, all of those kind of things, and yoga, obviously. And
movement.
Just movement. And breathing correctly. Breathing, will just bring more oxygen in, will increase circulation, and just keep the chemical balance more correct.
Well, there's an osteopath all day long. I'm dealing with arthritic patients, and there's a lot that can be done to maintain that movement and encourage it, and with corrective exercises as well.
No, I was going to ask you about, a lot of time people say when they've got, I don't know if it's necessarily with osteo or rheumatoid arthritis, but that they can feel it when the weather changes. Is that to do with the synovial fluid and how that changes?
It's
like when the rain comes in, they say, I can feel it.
It's not a myth.
I wondered what that was.
It's not an old wives' tale. What happens is, there was a work done by a man called Banham on this, but in everybody's joints, what happens is that they're subject to the effects of atmospheric barometric pressure. So cold, damp weather, hot, humid weather. Now, if you've got a joint which is inflamed, because what happens is that the effects of the atmosphere cause the cartilage to expand.
Okay.
Now, if the tissue is already inflamed, it will expand more. So hence, cold, damp weather, hot, humid weather, you'll get your aged aunt saying, "Oh, I can tell the weather's going to rain tomorrow because my knees are playing out." It's true. And you've got, so it's absolutely, classic feature that they know what's going to happen. So it's not an old wives' tale.
What's the best thing to do then? Would you put a warm compress on that then, or a cold?
Well,
if I've got an achy knee, because I get inflamed knees sometimes, in the weather when it changes, I want to put on a bit of an ice pack sometimes. Or
when it's cold,
I might put an electric blanket over my knees. I mean, it depends how I'm feeling. If it feels really inflamed and like clicky, I think, well, I'll take out the inflammation with some cold compress, and then once it's got too cold, I might put something hot on it. Is that the right thing to do?
Well, it depends. For some problems, ice helps. For other problems, it can aggravate. It totally depends on the individual, and we're back to that whole thing of never giving specific advice without seeing. So we'll remember we're here not to give specific advice. So seek advice from your medical practitioner or your alternative practitioner. Sorry
for interrupting. Sometimes the alternating
alternate hot and cold
it is actually the
but remember, it's you're using it as a transport system. The blood supply is a transport system, bringing in nutrients, draining away damaged tissue. But for some problems, ice is the worst thing you can use. But for another, with an individual patient, remember our approach is very much looking at each person as an individual. Ice may help one, but be the kiss of death for somebody else's knee problem. Alternate hot and cold, or hot on its own, tends to feel soothing, but does very little, really. So it's all about the individual.
So we're not much clearer on that.
Well, because you've got to look at the individual problem.
But using your muscle testing, you can muscle test individuals, bio-individuality.
Not everyone's got a pocket me, have they?
No, that's true. Let's have to come see you.
I will try and work on that for 2018.
If you'd like a pocket, Leonie, please contact this number.
You'll find her on the Facebook page.
I think if we think about prevention as well, I think if you look at a lot of people's sedentary lifestyles now, one way to kind of is to keep moving, is to keep yourself moving. I know this might not necessarily prevent this, and there are lots of other, different causes. But keeping yourself using, they say if you don't use it, you lose it.
Precisely.
And I remember my grandma lived until she was just before her 95th birthday, and she actually suffered from rheumatoid arthritis as well. You could see, in the hands, and but she still had her personal trainer come to her house, and she had the squidgy Pilates ball that you have, and I've got this great picture of her doing her exercises, moving her knees together. But her flat was on the second floor. She was walking all the way up until then, and really, really healthy. But she kept living. She kept doing, everything in her life that she could. She drove until the last point that she could. So I think movement is really important.
Just knowing your limits, isn't it? Knowing your limits, but keep on going. Yeah, don't sort of sit there and go, oh, I've got these terrible knees, so I'm not going to do anything. You can swim. You can swim.
I'm getting old. I can't do anything anymore.
And give in.
Just keep in.
Movement is the key.
Is rheumatoid arthritis hereditary?
Yes, there is an inherited factor in some, but not in all.
Okay.
For example, with ankylosing spondylitis, there's an inherited defect called HLA-B27, which is an antigen. Which is a marker you see in the blood supply when you do a hematology test on those patients. You normally find the HLA-B27s there, and there'll be a history somewhere in the family, but not in his case. His was due to a direct...
That was fascinating, wasn't it, how he started listening to the story? Salmonella food poisoning. I mean, that's awful.
Unbelievable.
Well, the other one is Reiter's syndrome, which is another of these seronegative types, not the positive, but the negative, where it's due to sexual infection. So they get non-specific urethritis, men or women, after sexual contact. And then, in the same way that his did, it advances into the other joints and then into the spine. All from sexual infection.
Right, no more sex.
No more sex. You can't eat.
No more sex, no more salads.
No more salads? Why no more
Oh,
salads?
he got salmonella, didn't he? Oh, no, it wasn't from salad.
right.
Was it from salad?
No.
It was a rice pudding.
Oh,
It's a rice pudding. Rice is a terribly dangerous thing to keep in the fridge.
It is. When I did a health
misunderstood
economics or health safety for cooking kind of one, it was doing residentials, and rice is one of the worst things that you can get food poisoning from. Just putting that in the fridge and having it again, not reheating it properly.
And
it's
lettuce.
one of the worst. Yeah.
And lettuce as well.
So if you're going to get a takeaway, you should always just cook the rice at home.
Yes,
The rice.
exactly.
A bit of advice.
So no sex,
No rice.
no salad,
No reheated
trips
rice.
to
no
Thailand.
reheated rice. But moving back to arthritis,
Yeah.
there's so much that can be done through yoga,
Yes.
through naturopathy, and the dietary approach. I mean, personally, as far as I'm concerned, for inflammatory arthritic conditions, it's of more benefit.
It's huge.
The fact that we're wearing out as we get older, there's not a lot that we can do to prevent that.
My
But
doctor told me I've got a spine of a 65-year-old.
I'd have slapped him around the face.
Would you do that for me?
Yeah.
You were lucky
No
he was
problem
65.
whatsoever.
I've got a knee of a 70-year-old.
Now, you've had some interesting work done on your knees, haven't you?
Well, I've had the hyaluronic acid injection, which sounds really dramatic, which I was just saying to Juliette earlier, actually, when I was looking it up, they said, well, all we'll do is we'll give you a hyaluronic acid. It was my physio suggested it, and he said, they might not want to give it to you, but you got to push for it. But actually, the guy offered it immediately. I was kind of a bit shocked. I was like, really, now?
Was that because you'd already got your dress off and your knee was in his face?
How did you know? Yeah, I came in going, and
Back
so I
to the
looked
sex,
it up,
yeah.
what the hyaluronic acid was. And another name for it is chicken shots.
Yes.
Because they use part of the crest of the chicken. They extract something from the crest of the chicken and create this fluid, which then they inject into your knee.
Hyaluronic.
Hyaluronic. Yeah,
Hyaluronic.
acid.
Is it not hyaluronic or is it hyaluronic?
No, it's hyaluronic, yeah.
But
Believe
it's
me, because I kept saying hydrolor, and I was like, no,
It's
that's wrong.
basically trying to create a new lubricating
It's a
mechanism.
lubricant, so there's something in the...
That sounds horrific.
Yeah.
But it didn't hurt, so that was...
Doesn't
Are they
always
corn?
work.
Are they
Well,
corn
haven't
fed
been
chickens?
laying
You
eggs.
didn't get the
Oh, yeah,
free-range chicken.
Do you find yourself waking up at 5 o'clock in the morning with the dawn, making funny noises?
No, does my knee tingle when
Just-
the
Yeah,
rooster
they
goes...
say- They say if you get someone's heart, that you take on some of the effects of that person. Have you heard? There's crazy stories out there.
Somebody.
So maybe you will start making chicken noises.
I think on that note, we'll move back to arthritis. So the naturopathic approach.
Yeah, really, that's right.
The dietary approach.
Yeah,
the yoga approach. The osteopathic approach, but also, as we said, sometimes if that joint is worn out, the surgical approach. And on that note, that was Arthritis from the Health Show.
Goodbye from us for
See you
this week.
soon.
Bye-bye.